Hello, my name's Kathy Creighton, and I'm the Executive Director at the Butler County Historical Society located on North 2nd Street here in Hamilton. And today we're going to talk about the Spanish influenza and focus in generally on what it was and then specifically how it affected Butler County in 1918 and 1919. And basically, there was 3 waves to the pandemic that happened for the Spanish influenza worldwide. The first wave basically was January through early March of 1918. The second wave resurfaces in Switzerland in August in 1918. This was the one that was very deadly, the one that caused the most of the problems. And then the last wave comes in basically January of 1919 through the spring of 1919. The entire pandemic basically only lasted 15 months. That was from the initial time in January of 18 until it disappears in the spring of 1919. Now, specifically, do they know where it originated? For sure, no. Originally, they thought it was China or Vietnam, but now it is the experts' belief that it actually originated here in the United States, and it originated in Haskell County, Kansas in January of 1918. Why Haskell County, Kansas? Well, there's a couple of reasons. It's a swine-producing area. And we know that a lot of, especially the flu viruses, can transfer from birds to swine to humans, and it's a vicious circle. And with it being a swine producing area, and it is also on the flyway for 17 species of migrating birds. So they're thinking probably what happened in January is this strain was brought in, was passed to the hogs, and was passed to the humans. But for certain, they don't know. But there was a local doctor in Haskell County, Kansas, that realized he was looking at something different than what he normally did. So he reported it to the US Public Health Service in late January, early February 1918, but that's as far as it went in the way of reports. So now how does it get spread? Well, several of the soldiers from Haskell County, Kansas, end up going to Camp Funston in Kansas. They take it with them when they go to report for training at Camp Funston. When the disease breaks out, initially people were sick. They had 38 deaths at Camp Funston, but they didn't realize that they were looking at something new. Basically, within 2 weeks of these guys getting there, it broke out and the disease traveled very fast through the camp. So how does it spread worldwide? Well, of course, the doughboys are now going to be sent over to Europe. So they take it with them when they go to Europe. It is called the Spanish influenza because they were not reporting what was going on here in the United States. Spain was neutral in World War I, and so they were reporting all of the deaths and all the outbreaks in Spain. And so that's how it got the name of Spanish influenza. It was also taking place in the United States, in Britain, in Germany, other places, but there was censorship on the war, and they did not want to start reporting these figures. And so they just kind of swept it under the rug and did not talk about it. But by May of 1918, they are saying that there was over 8 million people dead of Spanish influenza just in Spain. What were the symptoms of Spanish influenza? Usually the incubation time was 2 to 3 days. It was an airborne disease. It spread very easily. And it was usually diagnosed as pneumonia or meningitis. It was not recognized as being a specific disease. You had a fever, cough, confusion. And if you look at this man's face, you started by developing what they called mahogany spots over the cheekbones, which is the top picture. Then as you start having problems breathing, you turn blue. And then usually death was within a matter of hours of if you got the real lethal force of this. About 90 years, almost 90 years later, in 2008, the researchers determined that it was a version of H1N1, and the reason it was so bad was it weakened the victim's bronchial tubes and lungs, and it made way for the secondary infections of either pneumonia or of meningitis. It was mostly deadly for people of the 20 to 40 years of age. And most of the more American soldiers died of influenza and other related than were actually killed outright in the war. Usually, like I said, it was fatal within a few hours, and it was you died because of complications, not actually the Spanish influenza. And your immune system went absolutely crazy if you were in the age bracket, usually of 20 to 40, which is what the most people that got it were of that age, and that was where most of the people were dying, was in the age group from 20 to 40. So people looking at what's going on with COVID-19 today say, what was the national policy? There wasn't one. And Wilson, President Wilson, Woodrow Wilson, was president of the United States at the time, and he committed a committee on public information. And he said, truth and falsehood are arbitrary terms. The force of an idea lies in its inspirational value. It matters very little if it is true or false. That was the job of the Committee on Public Information. So they didn't want to put out any news or any stories of anything that would ruin the morale of the people for World War I. So then Wilson passes the Sedition Act, and it made it punishable with 20 years of prison to utter, print, write, or publish any disloyal, profane, scurrilous, or abusive language about the form of government of the United States, or to urge, incite, or advocate any curtailment of production in this country of anything or things necessary or essential to the prosecution of the war. In other words, you didn't talk about Spanish influenza, and if you did, you literally could be punishable for 20 years in prison. So the public health people determined to keep up the morale of the people, starting to lie, saying, oh, well, Spanish influenza, it's no big deal, nothing we're going to worry about. In the Surgeon General of the United States in the early fall of 1918 said, there is no cause for alarm if precautions are observed. The handling of the disease was left up to the individual states and to the individual municipalities, and there was no national policy. October 5th, 1918, the Division of Sanitation of the Navy finally comes out with guidelines as to what you should be doing to try to keep yourself safe from getting Spanish influenza. It says, keep well, don't get hysterical over the epidemic, be aware of those who are coughing and sneezing, avoid crowded streetcars, that would be the equivalent of staying off of airplanes today, keep out of crowds, avoid theaters, don't travel by the railroad, don't drink from glasses or cups which have been used by others, and avoid close, stuffy, and poor ventilated rooms. Again, now, this is 10 months after the initial outbreak that this comes out. American Red Cross, November 6th, 1918. They're saying treat all colds, however slight, as influenza, stay home, avoid crowds, avoid breath or expelled secretions, wash your nose out, or gargle, use with salt water. And if you're attending patients with the flu, you should start wearing masks. But again, nothing really specific. So if you look over there, it says now influenza is a crowd disease, and that's dated October 5th, 1918. That is coming from the Hamilton paper. So let's take a look at what's going on here in Butler County. Hamilton has a population of about 39,000 people in 1918. And on October 5th, Mayor J.C. Smith closes all schools and public buildings, and he's going to close all churches by October 14th. By October 7th, there is at least 1,000 cases in Hamilton, and doctors are working 7 days a week for at least 3 weeks, averaging more than 100 house calls a day. That's according to Jim Blount. People are taking care of the sick, are urged to wash their hands frequently and use gauze over their nose and mouth. Mercy Hospital is overfilled, and they set up 3 tents behind the hospital to handle the overflow. This is actually a picture of the 3 tents that were set up behind Mercy Hospital here in Hamilton. In Middletown, their hospital reached capacity and their overflow was set up at the Elks Temple. Now, let me tell you, in 1918, when this starts, there are only 2 hospitals in all of Butler County, Mercy and the one that's in Middletown. And the one that's in Middletown had been open for less than a year. So what was closed and canceled? Schools were closed twice, in October of 1918 and again in December of 1918 when there was a resurgence of the flu. Miami University closes, all churches, meetings, movie theaters, any buildings used for recreation, clubs and lodges. Halloween was canceled and store Santas were banned. And it's interesting, you go, well, what shortages did they have? The only shortage that I could find was that there was a run on Vicks Vapo Rub during the Spanish influenza. Funerals in Butler County were limited to family members and were no more than 15 minutes long. Caskets had to be closed or have a glass covering over the deceased. People were asked to wear rear gauze masks in public. The bodies were piled up because they didn't have enough grave diggers. And so Greenwood Cemetery actually got permission to use the inmates from the county jail to assist in the grave digging. This is the height of what we would call today wave 2. In Philadelphia, they were saying that so many people died that they were having to bury people in mass graves. Now, who would think of that in 1918, that that would have to be the case? In Oxford, it was interesting. Their first case was reported on September 18th, 1918. That was the day that students were coming back and enrolling in the fall term. By October 3rd, officials were in compliance with a state requirement, sent the women home. There was 453, and shortly thereafter sent the majority of the men students home, with the exception of the students that were enrolled in the Students Army Training Corps. They stayed on campus in order to help with the pandemic. Miami's president at the time was Raymond M. Hughes. He ordered the campus chapel and services and other gatherings canceled. He told students and Oxford residents that stayed behind to avoid large crowds, including church services, movies, and school. Part of Bishop Hall, which was a dormitory at the time, served as a hospital, but soon it was inadequate, and patients were also housed at Johnson Hall. There was a total of 8 deaths in Oxford. Now, it's kind of interesting, Dr. Wade McMillan, a Cincinnati physician, had just been hired that fall by Miami University as the first medical director, and he had just assumed his position when the first case was reported. Prior to that, Miami did not have an on-staff physician, and local physicians were designated to take care of any students, although they did have a resident nurse. When the Miami students registered in the fall of 1918, for the first time, they paid a $5 medical fee that was to assure the privilege of all ordinary medical advice and a limited amount of hospital service if necessary. Poor Dr. McMillan did not have time to start his preventative medicine before the flu started. As only 15 days after the students returned, the women were ordered home, and already 2 students had died from complications of the disease. Now, medical records are incomplete, and I'm going to talk about why in a minute, but if we look specifically at Oxford, there were 340 cases, 174 men and 166 women reported in the student body, with 400 students hospitalized for more than a day or more. So let's now take a look at some of the statistics. Restrictions started to ease in Hamilton around the 5th of November. And they allowed churches to reopen and schools to reopen, but then they were again closed from December 2nd through the 16th. And one of the things people ask is, why don't we have set statistics as to how many people died and what their ethnicity was and all of this information? This all goes back to something called a reportable disease. The United States and most governments have diseases that they declare as being a reportable disease. Spanish influenza does not become a reportable disease in the United States until October 10th, 1918. That is 10 months into the epidemic, and basically 6 months until the epidemic ends. So all of the early statistics were not kept. And the same thing was worldwide. They didn't keep the statistics like we do today. So if you want to know ethnicity and stuff, we don't know. This was not kept. But if you look at Hamilton, there was 1,435 cases in the month of October with 163 deaths. November, there was 42 deaths. From what we can tell, in 1918, there was 2,479 cases with 264 deaths here in Hamilton. Middletown, the best we can do is October, there were 74 deaths, and they had a total of 100 plus deaths. If you go down and you look at in the county, deaths wise, we know there was 7 in Fairfield, 1 in Hanover Township, 3 in Ross Township, and 6 in St. Clair Township. We have no idea how many actual people got sick in Butler County. We had 34 military deaths. That would have been soldiers from Butler County that died as a result of this. And it's like, you go, well, okay, well, how was things going on? Cincinnati had over 100,000 cases during this time period with 1,800 deaths. There was no vaccination for Spanish flu. If you think about it, the first flu vaccine wasn't even developed until the 1940s. So that's basically 20 years after the Spanish influenza. And of course, now today, the manufacturers can routinely produce vaccines. So let's take a look at the third wave. Now, the third wave basically crops up during the Paris Peace Accords or Peace Conference. And President Woodrow Wilson, shortly after arriving in Paris, collapses. Some people say he had a stroke, but if you look at what his symptoms were, he was suffering from Spanish influenza. 103 degrees, intense coughing fits, diarrhea, extreme confusion. And people are saying that he went in and was wanting to be very lenient on the Germans. Well, by the time he's sick and starts to recover, the other allies have come down very hard on the Germans. And they're saying that this is why he changes his stance as to what is going to be in the peace accords. His staff downplayed his illness, telling him that he was not sick with the flu. Wilson never admitted that he had the Spanish influenza, but 6 months later, he suffers the debilitating stroke that left him paralyzed on his left side and partially blind. Now, as people go back and, like I said, look at his symptoms, they're saying it probably was Spanish influenza that he was suffering from. So if we kind of look at worldwide, what was going on, as I said at the beginning, the Spanish influenza basically was over with in 15 months. We will never know exact death totals or infection rates because it was not a reportable disease during most of the time. But you see roughly 650 to 680,000 deaths in the United States. They're saying roughly 28% of the population got the flu. And that was 10 times greater than all of the men that were killed in World War I. The majority of the deaths were from bacterial pneumonia, a secondary infection. But you did have people that were killed outright because they had massive hemorrhages and edema in the lungs. And roughly 20% of all people that were infected with the Spanish influenza would die from Spanish influenza. So let's just take a little look at how the world might have changed if Spanish influenza had not happened, or if it did happen. Let's look at some of the people who survived Spanish influenza. And what would the world be like if Walt Disney would have died from Spanish influenza instead of surviving his bout with Spanish influenza? No Mickey Mouse, no Walt Disney World. I don't even want to think about it. Other people that had Spanish influenza, David Lloyd George, the English Prime Minister, General John J. Pershing, who was in charge of all the US forces in World War I, Franklin Delano Roosevelt, and Wilhelm II, the leader of Germany, all survived Spanish influenza. Who didn't survive? The Dodge brothers, as in Dodge Motor Company. Both brothers died of Spanish influenza. Phoebe Hearst, who was the mother of William Randolph Hearst, dies. And the one that I think was rather interesting was Frederick Trump, the grandfather of Donald Trump, dies of Spanish influenza. So that's what I have today. If any of you have any questions about Spanish influenza, feel free to contact me here at the Historical Society, and I'll see what I can do to kind of come up with answers for you. Like I said, statistics and a lot of this data is not very readily available because they did not keep it. And if you're looking for more reading, I would suggest that the Smithsonian Magazine ran an excellent article on the Spanish influenza in November of 2017, and it's an excellent source for information and history on the Spanish influenza. I want to thank you for joining me today.